चल हो जा शुरू।
केसरिया से मन जोगी हुआ रे, दिल झूमे देखो पतवारा हुआ रे, दिल झूमे देखो पतवारा हुआ रे।
हर पल मनाओ केसरी त्योहार। विमल, बोलो जुबान केसरी।
First to Gaza, where we're deeply concerned about Israel's increased military activities in Rafah, where most of Gaza's people have fled for safety. An estimated 30 to 40,000 people have left Rafah for Khan Yunis and Deir al-Balah, but more than 1.4 million people remain at risk in Rafah, including 600,000 children. Already one of Rafah's 3 hospitals, the Al-Najjar hospital, has had to shut down, and its patients have moved elsewhere. And hospital staff are removing supplies and some equipment to safeguard them. The Rafah crossing from Egypt into Gaza remains closed, which is a major access point for supplies into Gaza. Fuel that we expected to be allowed in today has not been allowed in, meaning we only have enough fuel to run health services in the south for 3 more days. WHO has pre-positioned some supplies in warehouses and hospitals, but without more aid flowing into Gaza, we cannot sustain our life-saving support to hospitals.
Maybe the most important element, what we all need humanitarian, is fuel. Fuel. Then, of course, also for humanitarian aid, but also staff movement and medevac. So I want to stress again, without fuel, all the humanitarian operations, including hospital operation, they come to a halt. In the south, our estimation is that hospitals only have fuel for 2 to 3 days left.
WHO is coordinating the work of 20 emergency medical teams in Gaza, comprising 179 internationals from 30 countries working alongside 800 local staff. These teams are embedded in 10 existing hospitals and have established 5 field hospitals. They have provided almost 400,000 consultations, performed more than 18,000 surgeries, and added more than 500 additional hospital beds. A ceasefire is needed urgently for the sake of humanity. And WHO calls for removal of all obstacles to the delivery of urgent humanitarian assistance into and across Gaza at the scale that is required.
This has been characterized as a restricted military incursion or a limited offensive. And the first act of that offensive is to cut off the 2 lifelines to 2.5 million people in Gaza. The first act is to stop the fuel, stop the food, stop the medicine at source, at the border. I don't call that limited, and I don't call that restricted. I call that a re-imposition of total blockade on nearly 2.5 million civilians who are already starving, who are already dying from preventable diseases, and who need our protection.